Hello, how you doing?
Good, how
My name is Gilbert Palacios. I'm your nurse today. I'm gonna be doing a patient teaching on diabetes. Can I please see your armband and your first and last name?
Gabriella Palacios,
Okay, and date of birth.
11/1/84.
Thank you very much. So before we begin, how would you like to be addressed? First name, okay?
That's fine.
Gabrielle. Okay, great. Are you comfortable at this time, Gabrielle?
I'm good.
Okay. Would you like a drink of water, or maybe would you like to use the restroom before we begin?
No, I'm okay, thank you.
Okay, good. So, um, I understand you've been diagnosed with type 2 diabetes. Do you have any prior knowledge in regards to diabetes?
No, not really.
No?
A little bit, but not very much.
If you don't mind me asking, what information do you know?
I understand that I have type 2 diabetes, which means I don't have to take insulin shots, but basically my body is not the insulin in my body. Maybe I'm not making enough, or it's not turning the sugar in my body into energy or into the cells it needs to turn into.
Okay, no, that's great. Yeah, um, yeah, that's a good understanding, I would say. Um, so, in this teaching lesson, the main objectives that I would like to focus on are nutritional therapy along with exercising. Okay. If at any time you have any questions or any comments or concerns, don't hesitate to ask. Okay. Are you ready?
I'm ready.
Okay, good. So I want to start off with the importance of nutrition. The overall goal of maintaining a healthy nutrition is to achieve a healthy level of blood glucose within the body. Um, Weight loss can be associated with insulin sensitivity, which basically allows for the insulin to bind to the receptor sites and allowing for the glucose to enter into the cells. Do you kind of understand what I'm talking about?
Yeah.
Yeah? Okay. If any questions, don't hesitate to ask. So weight loss is associated with insulin sensitivity, like I said. Weight loss is recommended for people with type 2 diabetes who are overweight and are obese. Um, so a nutritional adequate meal plan with appropriate serving sizes, reduction of saturated and trans fats, and a low carb diet can reduce the calorie consumption. Okay, so spacing meals to spread nutrient intake throughout the day is another strategy as well. Okay, so at this time I would like to introduce the My Plate method. Are you familiar with the My Plate method or strategy?
No.
No? Okay. So the My Plate method was developed by the U.S. Department of Agriculture. It's a simple and effective method for both managing diabetes and losing weight. It allows for you to choose the foods you want, but does change the portion sizes. So you're getting a larger portion of non-starchy vegetables as compared to starchy foods. Okay, so first thing is you're going to be using a 9-inch plate. With that 9-inch plate, you're going to cut that plate right in half. Okay, on one of those halves, you're also going to cut that section in half. So you're going to have a total of 3 sections on your 9-inch plate. Okay, your your larger portion or the half, you're going to include that portion or that section with non-starchy vegetables. So the largest portion is going to be your non-starchy vegetables. These can include fresh vegetables, frozen or canned. If you're using the canned vegetables, try to use reduced sodium, no fat, and no sugar. If for some reason you're using the canned vegetables with sodium, just remember to rinse the vegetables with water to reduce the amount of sodium on the vegetables. Okay. Um, Some examples of these foods can include carrots, asparagus, mushrooms, onions, salad greens. Um, these are just a small example of the type of foods that are non-starchy vegetables. But I'm going to provide you with a website that you could refer back to, and it'll give you a long list that you could choose from. Okay. So that section you're going to fill up with your non-starchy vegetables, which is your largest portion size. Okay. For the smaller section, you're gonna include foods that are starchy foods or grains. These foods can include peas, corns, lima beans, and potatoes. Okay. Like I said, it's just a small example of what you can choose from, but I'm gonna provide you with the website where you can have that longer list, and then you can refer back to. Okay. Your last section, the smaller section, you're gonna fill that size, or that's gonna be your protein portion. So it's gonna be foods such as your fish, your poultry, your meats, your soy products, or cheese. Okay, try to include fish as your protein at least twice a week, as it's high in omega-3 fatty acids. When using poultry, make sure to eliminate the skin to reduce fat and cholesterol. And when you're using cheese, try to use reduced fat. Or if you're using regular, just make sure you cut down on the amount. Okay. Um, so those are going to be your three sections. Any questions so far?
No.
Okay. So in order to complete that meal, you want to include an 8-ounce glass of milk along with a small piece of fresh fruit. Okay. Um, when using, try to use cooking oils if needed instead of butter. Okay. Excuse me. Also choose healthy fats in moderate amounts, small amounts. Okay, for salads, if consuming some salads, some additional additions or some additional nutrients that you can add are nuts, avocados, and vinaigrettes. Okay, um, and if desired, you can add low-calorie drinks such as water, unsweetened tea, or coffee. Okay. Um, any questions at all so far in regards to the My Plate strategy?
No, but is it for 3 meals a day?
Correct.
Okay.
Yes. 3 meals today, and like I said, a good way to lower calorie consumption is by spreading your meals throughout the day. Um, but you want to make sure that you're consuming enough foods so that you're not going into a hypoglycemic state, right? You want an adequate amount of sugar, but not an excess amount. But you want to make sure that you're at least eating, yes, 3 meals a day. Correct. That's a good question. Anything else?
No.
Can you just tell me maybe 2 things that we just talked about in regards to the My Plate strategy?
Sure. I have to use a 9-inch plate, which I would visualize in cutting it in half, and then one of the halves in half as well. So there should be three sections. The largest section will consist of starchy vegetables or non-starchy vegetables in the largest section.
Correct.
On one of the smaller sections, it would be starchy vegetables, and on the other smaller section, it would be my protein or cheese, preferably low fat. And if I use canned vegetables, make sure I rinse them to take off the sodium.
Great. Yeah, that's perfect. That's really good. I'm glad that you're catching on. So now we're gonna move on, and I'm gonna explain the exercising and its importance. Okay, and it's very important to remember that nutrition or a healthy nutrition goes hand in hand with exercise. Um, it's essential in managing diabetes. Okay, the ADA recommends people with diabetes to engage in at least 150 minutes of physical activity a week, which equals to 30 minutes uh, for 5 days out of the week. Um, this is a moderate intensity aerobic activity. Okay. The ADA also encourages people with type 2 diabetes to perform resistance training at least 3 times a week as well. Um, Exercise can decrease insulin resistance and can have a direct effect on blood glucose levels, um, which can lower it, right? So this can also decrease the need for diabetic medication as well. So it's very important to remember to include exercise in your lifestyle modification or lifestyle behaviors, okay? Um, so first off, exercise does not have to be vigorous in order to be effective. Some activities can include gardening, um, active housework, and walking briskly, okay? Remember to make sure to choose exercises that foster regularity, meaning something that you like doing. Um, it's going to help you stay motivated to continue to exercise. If you do something that you don't really like doing, chances are you're probably not going to continue with it. So make sure you're choosing something that uh, that you want that you're going to stay motivated to do. Okay. Make sure to use properly fitting footwear to protect your feet to avoid rubbing or any injuries. Um, Exercise sessions should include a warm up period along with a cool down period. Excuse me. And you want to start gradually and increase slowly on your physical activity. Okay, you don't want to just go high intensity right away. Okay, um, and also exercise is done uh, best after meals as glucose levels are on the rise. Okay, do you have any questions so far in regards to exercising?
No.
Okay. Can you maybe tell me at least 2 things that we just talked about in regards to the exercising?
Sure. So I need to exercise at least, I think you said 150 hours a week. Oh, is it 150 hours?
No, that's okay. 150 minutes.
Minutes, sorry. 150 minutes, thank you.
150 minutes
A week.
per week.
So basically 30 minutes a day for 5 days.
Correct.
Which can be spread throughout the week, correct?
Yes. Yeah, it doesn't have to be in consecutive days. As long as it's 5 days throughout a 7-day week,
okay.
Should be good.
Okay, and also to do aerobic exercises, as well as resistance exercises a couple of days a week. Also do things I enjoy doing so that I can continue to exercise.
Yeah, exactly. That's good. I'm glad that you learned something. And like I said, I'm going to provide you with the website so you can refer back to for the My Plate strategy. And if you have any questions, concerns, don't be afraid to call your healthcare provider or diabetic expert so they can relay some more information if needed, okay? Mm-hmm. I thank you for your participation. This concludes our patient teaching, and I thank you. Appreciate it. Thank you.